Hello, my name is Josephine Vega, the in charge of Oncology Department in Nsambya Hospital. You are most welcome to our Rotary-Centenary Cancer Building from Nsambya Hospital. Please come with me and I take you around. Okay, this is our reception where we receive our patients. You can come in. This is one of the patients who has just come in, and this is where we do the triage. We find out what is happening to the patient. Then from here, after the triage, we send them to the doctors who are going to review and send them for other investigations that are necessary according to the patient's complaint. Let's continue. Of course, as staffs, when we come in, we come with our clothes. Then this is our staff changing room. This is where the medical oncologist sits, and after the patient has been triaged and we know that this patient goes to such and such an area, this patient goes to such an area. If he needs a medical oncologist, we send them here to this room. There's a patient in who is going to be seen. Of course, as patients come, when there are many, they first sit here. This is our waiting area. These are some of the patients that are waiting to be seen by the doctors. We send them one by one, so it's a first come, first serve, or at times it depends on the condition of the patient. If we see that maybe somebody came, maybe it was number 3 or number 4, but we see the condition is not good, we can push him first so that he's looked after and we do the needful. These are other departments that we have. We have the surgical oncologist. She sits here, the surgical oncologist. If the patient needs the surgery, this one looks after the patient, then he takes her to surgery, to the surgeon. Our head of department also sits here. She's also a surgeon, a consultant surgeon. Then this is our nurses station, that as patients are waiting there in the nurses area, at least a nurse is watching to see who is bad off, who could go in first. We will take priorities of who is much need of an oncologist at that time. So the nurse sits here. Those are washrooms. And with the cancer, we keep on researching and finding out new other things that can be done to help patients. So our research unit is here. And we have our mini lab in this room, such that our patients don't have to walk again to the universal lab to be taken off samples. So our samples are taken off from here so that our patients don't overmove going to other centers. So everything is done here. Then here we have the gynecologist. The oncologist who deals with ladies or with women with gynecological problems. This is the office. Then we have a clinical psychologist. She also sits here. This is an office for a clinical psychologist. You know, with the illness, many problems happen to patients. The time they tell you you have such and such a diagnosis, psychologically you're affected. You think of where to get the money, who will it be on your side, what will help you, what is the prognosis, how are you going to suffer, how are you going to manage that suffering, because cancer causes a lot of pain. So she's the psychologist. She sits here. And this is our palliative care unit. Palliative care is the specialty that looks after patients with life-threatening illnesses, and it's mainly for pain management, and this is what I heard. I'm in charge of this unit. Yeah, we deal with the patients. We look at patients holistically. We deal with the physical aspects of the patients. As the patient can tell you, I have maybe abdominal pain or headache, then you know. We deal with the psychological problems, and the psychological torture affects the patient and the caretaker. How does it affect the patient? It's like, because he's the one who's thinking about the suffering, he's the one who's going to take the medication, he's the one who goes through the pain. Then the caretaker, how it affects her. Maybe she's now looking after the patient in hospital, but she has other things she has to do at home. She has a family which she has left. Maybe the other time they sold part of the land to get the money to treat the patient. Now he's back on admission. So all those are tortures to the patient, to the caretaker. And this is our gynae room or procedure room where we do the screening from, especially gynae patients. So all gynae screening is done from here. Like the pap smears and the rest, they are done from here. Then from here, after somebody is diagnosed and we know the diagnosis, we know what we are dealing with, all other investigations have been done, and we see that now the patient is ready to receive the chemotherapy. After the patients have been diagnosed and we found out that now this patient is ready for chemotherapy, all other investigations are okay. We have the liver is okay, the kidneys are okay. We don't have any doubt on this patient. That patient, after being seen by the medical oncologist, he writes the medication. Then this is the chemo suite where we bring our patients to receive the chemotherapy. There are 4 different units. Of course, as the patients are here, this is the nurses station where nurse sits. That in case the patient needs anything, they come and sit here. That's some of the provisions where we keep our things. As per now, there are no patients, but sometimes you find all these rooms are full of patients as they receive their chemotherapy. We are so thankful for you people, as you always provide us with the things to use on patients, because you find them very clean in white sheets, and that's why some of them at times they don't even want to go back to their homes because of the care they receive here. Sometimes they say, maybe for us, people working here are different from the other team that works in the hospital because of the care they receive. So we are so grateful for all the things you give us. So these are the chemo suites where we give our patients the chemotherapy. But chemotherapy is the drug that we give to cancer patients to relieve them of the suffering. Some of it can be palliative, some of it can be curative, depending on the level the cancer was attacked. So this is our cabin where we mix our chemotherapy from. That in case we are to give it to our patients, we prepare it from here, then we give to patients in those chemo suites. Because this is the nurses' station. Going to the preparation room of the chemotherapy, they pass through here. This is the passage to the chemo preparing unit, and this is their office. And this is our waiting area. As I took you around and showed you that most of our patients, after being investigated all well, and we find that the patient needs chemotherapy, we give them the drug. We give them drug from our chemotherapy suite up there. But in addition, some patients need radiotherapy. So we are so thankful to Rotary Club and Centenary Bank, because with the help they've rendered to Nsambya Hospital, this is how far we've gone with the radiotherapy department. We are putting up this building so that at least the patients, the workload will be relieved from Mulago Hospital. Where in Uganda we have been with only one machine of radiotherapy, now we want to put up another one in Nsambya so that our patients don't suffer moving up from Nsambya to Mulago, where there are large numbers of patients. So this is our radiotherapy department, which is going to help patients to relieve most symptoms that are stressing. Some patients may be bleeding, and other causes of diseases that need radiotherapy, they'll be dealt with from here. We are so thankful to Rotary Club. So I invite you everybody, I invite you all, come and join us in our cancer run, which is going to take place on 25th this month at Wuma grounds in Lugogo. This month it's not Kololo, but it's not Kololo as it has been always, but this time it's in Wuma grounds in Lugogo. Come one, come all. A t-shirt is going to be at 30,000. Please come and join us. Let's help our patients. You never know. Today is somebody who is having a cancer. Tomorrow it may be your relative or anybody, or it can be somebody in your lineage. So let's help each other to help patients who have cancer and other illnesses that need radiotherapy. Thank you.